Okay, let's talk about acute cystitis. It is an inflammation of the urinary bladder. Okay, it is inflammation of the urinary bladder, presents as urinary bladder. Let's just make a urinary bladder here. So you have the kidneys, ureter, urinary bladder, and urethra. So here's the cystitis. It presents as suprapubic pain, dysuria, urinary frequency, urgency. Systemic signs are high fever, chills are usually absent, so no systemic signs. Okay, risk factors include you have a female sex because of short urethra, sexual intercourse, indwelling catheters, diabetes, impaired bladder emptying. What are the causes? E. coli is the most common cause. Staph saprophyticus, seen in sexually active young women, very important. E. coli is still more common in this group. Then you have the Klebsiella and Proteus mirabilis. Urine has ammonia scent if you have Proteus mirabilis. Okay. So you have all of these causes of the bugs. In the labs, you will have positive leukocyte esterase due to the pus in here. So why do you have this positive leukocyte esterase? Because of the presence of pus, you have positive leukocyte esterase. Positive nitrates, which indicates the presence of enterobacteriaceae, which are the gram negative. And what do the gram negatives do? Well, they convert the nitrates to nitrites. So nitrites, so they convert nitrates to nitrites, so that's why you have the nitrites positive. Sterile pyuria. Pyuria with negative culture can also be seen. Okay, that means basically no bacteria can be seen there, which suggests that the urethritis is caused by Neisseria gonorrhea or chlamydia trachomatis. Okay, so if you have sterile pyuria and you have cystitis or lower UTI basically, then you can all think about Neisseria gonorrhea or chlamydia trachomatis if you have a pyuria with negative urine culture for any bacteria. Okay, treatment. Well, something else actually, one more thing here. So when you have sterile pyuria, you are going to think about these two bugs, but on top of that, you're going to think about renal TB or institutional nephritis. Renal TB or institutional nephritis. Okay. Treatment: antibiotics, for example, the trimethoprim or sulfamethoxazole or nitrofurantoin can be given. Now let's talk about something which is, if you have recurrent or frequent cystitis. One of the causes for this thing is if you have the weakening of your vesico-urethral junction, which causes the vesico-urethral reflux. Without the reflex, ascending infection can cause pyelonephritis. So you need the reflex if for the infection to go up and cause pyelonephritis, which is the infection of the kidney. So we're talking about here, let's say this is the VUJ. You have frequent cystitis is going to cause the bacteria to go up and cause pyelonephritis. Okay. So these are the causes, and these are the labs that are going to be positive with the cystitis. But the question is, what are the bladder antibacterial defenses? So let me just write them here. So what defense do we have? What does the bladder has as an antibacterial defense? So first of all, the bladder mucosa doesn't allow the bacterial attachment. Normal urine is bactericidal itself. Urine flow washes the bacteria out. Okay, when these factors, any of them, are disrupted, or the bacterial virulence factor, or if you have the bacteria which has some virulence factor, for example, Fimbriae, for attachment or capsule to resist phagocytosis, at that time UTI occurs. Okay, so yeah, that's pretty much all we have for acute cystitis. Now let's move on with the next one.